Thank you for joining us today. I'm Danetta Sloan and I work with the Center. Today I'm talking with Dr. Ronit Elk. Dr. Elk is a professor in the Department of Medicine at the University of Alabama, Birmingham, and a distinguished researcher focused on determining cultural values and preferences in the African American community, particularly at end of life. And then she uses what she finds or those results to develop culturally based palliative care interventions to inform training for clinicians in culturally appropriate care for Black and Brown people facing serious life illnesses. Dr. Elk is also a member of the African American Advanced Care Planning and Palliative Care Network. That's a part of the Center's effort to increase participation of African Americans in advanced care planning, in the advanced care planning process by working with faith communities. Welcome, Dr. Elk, and okay if I call you Ronit. Thank you. Ronit, you recently participated in a wonderful roundtable discussion responding to healthcare disparities and challenges with the access to care during COVID-19. And I'd like to talk to you a bit about that experience. Some of the themes of that conversations were process and communication and inequities and mental health, but your priority was how culture influences and shapes how individuals make meaning from their life experiences, such as illnesses and suffering and death.
Yeah.
Talk to us a bit about that, the cultural differences that you see and how we can incorporate cultural humility.
Oh, my favorite word. Thank you. Wow. So culture, everybody sees through their own eyes and their own culture. If you ask somebody, what's your culture? They'll say, oh, I know what my culture is. I'm African American, I belong to this church, or I'm a Southern, whatever it is, people know what they mean by culture. And how we look at the world comes from within through our cultural lens, especially more when somebody is seriously ill and somebody is maybe on the, like, condition saying you might die and so on, and then during the death process. And one of the things that I'm really concerned about in the US, we sort of, even though palliative care physicians, clinicians are really good at taking care of the individual patient, they're very much concerned about, well, this person, this is what they wanted and this is what they're doing. That's very much an individualistic approach, which is how most of Western society is. But in the African American community, particularly in the Southern, we found that it's much more of a group culture, of the family, the community, the church is all part of it. So you can't just go for what one person wants. You have to include the whole group process. And that worries me, that people in the US are not taught, or let's say the clinicians are not sufficiently taught about different cultures and to respect different cultures. And so when you say cultural humility, a lot of people think, oh, well, no, I respect the culture, but they're coming at it from their own cultural lens. It takes work, insight, and training to get people to see, oh, I didn't even realize I was doing that. I didn't even realize that that was so important for this family. I didn't even realize that having the pastor there is a key aspect, and that I have to speak to the family, and that I have to respect the pastor. I have to respect the family.
Right. Thank you so much for that. One of the issues you raised also during your discussion, that panel discussion, was the importance of including pastors in advanced care planning for African Americans, which also was highlighted in a study you did in Beaufort, South Carolina. As you know, the center is really passionate and focused on including faith communities because of their importance in advanced care planning. Tell us about your study and talk more about the presence of a spiritual leader in advanced care planning discussions.
One of the things that astounds me in America is how people, I don't want to be rude, but the white community does not respect the leadership role that African American pastors play in the community. They are not only religious leaders, they are not only spiritual leaders, they are leaders for everything that the community discusses and decides. I've had people in focus groups in the South talk to me about how the church is everything, the pastor is everything, everything we learned comes from the church. And so it's so central. Pastors are central, and spiritual leaders in the African American community. And I can really just talk for the South because I don't want people getting upset saying, you don't know about the North. It's true. My knowledge comes from the South. The work that we did both in Beaufort, South Carolina and Orangeburg, South Carolina, we partnered with pastors and we asked them what they wanted, how clinicians should talk to their African-American patients, what aspects should they respect? And the community themselves said, if the physician is going to be giving you a serious prognosis like, oh, you know, you're not going to live long, that's not the way to do it. You have to have the pastor present. You cannot talk to the person on their own and give them such news. You have to have the family present and then explain it to them in a different way. You never say the word, oh, you're going to die. You never say the word, this is what the community have asked us. You never say you've got X amount of time left. You always have to say, there's hope. We have hope. You ask the pastor to say a blessing, a prayer, you know, for hope. Whether the person passes or not, you let that decision come from the pastor and from God, not from the physician. And in terms of advanced care planning, do you want me to talk about that?
In your experiences,
Okay, so one of
the research.
Okay, thank you. The thing that I found the most is that there's such a lot of distrust in the medical system, and for very good reason. And Tuskegee, people always say Tuskegee, that's only one reason, ladies and gentlemen. There's lots of other unfortunate reasons why there's distrust. And so asking somebody to write something down and to have it in writing and then give it to the physician, people have said to me in focus groups in our studies, what? If I write it down, then you're not going to do anything for my mother. No, the way it's done is my mother will tell my sister or my brother, they are the ones who carry that information. So to me, it's very important that in terms of advanced care planning, we don't do things the way it's always done. Here's a piece of paper, here's the questions that I'm going to ask you, what do you want done? We're not understanding the role of culture. And in that culture, the pastor is key. The pastor is key.
Okay. Thank you. Thank you very much for those comments. And, you know, I just want to clarify that those are your experiences from your studies that you have done in the South. So yeah. I want to clarify that. And you mentioned that the pastors play a very important role in the African American community. And I'm wondering, you also mentioned in the roundtable that they should be included in ethics committees.
Oh, please.
Can we discuss the values of trust and transparency and communication and their inclusion and how that can be enhanced?
I just don't understand, particularly now it's come to the forefront, how we don't include African American pastors in situations, particularly with the COVID now, that ethics committees are making decisions about, okay, let's see who we're going to give if we don't have enough machines, who do we give the ventilator to? You must include African American pastors around the table so that they not only are there, as a sort of, oh, I've got somebody who's Black, no, who's somebody who can speak for the community and who can express their values and wishes. Otherwise, as some of my colleagues have seen, that's going to be discarded. Even though people think they're doing the right thing, pastors must be included.
Okay.
And I did want to say one other thing that you had said earlier. Thank you for pointing it out. Obviously, I'm not African American. I'm not American born, but the work that we do is partnering with the communities. And what I'm saying is what communities have told me, not at all my own opinion. The passion is mine, but the opinion is from the community.
Thank you, and we appreciate that. Thank you so much. Your experiences are vast, and you say often that you're not from here. You weren't born here. Can I please ask you, or would you like to say where you were born?
I was born in Israel, but because of my father's work, we moved from country to country. So I've spent my life every few years in another country, and many of the countries were in African countries. And so I've learned to respect different cultures.
Thank you, and there goes your passion. I understand. You know, recent CDC data shows that COVID-19 is affecting African Americans at exceptionally high rates, amplifying pre-existing social inequities tied to race and class and access to the healthcare system. Is there a role for advanced care planning in affecting this paradigm?
There's a role for, I'm scared to say anything that will get me into big trouble, because all these things that are happening now are because of systemic racism. I'm sorry to say institutional systemic racism, which is why people don't have food. They have food deserts in their communities. They don't have access to care. They have justified distrust of the healthcare system. They cannot get to the high positions. I'm obviously generalizing in life, so the income is low. They're unable to get mortgages. Of course, all these things are going to affect very much your health and your outcome. And so the reality is that whether it's advanced care planning or whether it's taking care of patients or whether it's prevention, we in America are going to have to wake up to see, look what this pandemic has shown.
Thank you. Thank you so much. And, you know, it's really relevant to all cultures, not just Black and white, but I think that it is appropriate for all people, all healthcare providers to be aware of, you know, cultural influences and also have humility around those differences, I would say. Is there anything else, Ronit, that you would like to share with us from your work, specifically in this area?
Thank you. The one thing that I found frustrating, and then I found a solution to it, not within me. When we created videos that the African American pastors had created to show clinicians how to respect African Americans, the physicians, didn't get it from the videos, and I was very upset. But my colleague, who's a brilliant trainer, he came together, and together he created a training program, and we have been training physicians slowly, a 3-hour training every time, and you can see the change that occurs. You can see the understanding coming in. You can see how they're willing to change practice. That's what's so important.
Thank you. Thank you for that very important work. Thank you so much for engaging in the work that is so important to our communities. Ronit, thank you so much for talking with me today. And thank you for joining us, everyone, for this edition of COVID Ethics Update, a service for the Center of Practical Bioethics. If you have questions, ideas, comments, or suggestions in the future and for future editions, please email us at covid@practicalbioethics.org. www.culture.org. Thank you so very much. Be well and be safe.
Thank you for having me. Appreciate it.
Thank you.